Hey, this is Donna Smith coming to you from my office in Washington, D.C. We're going to present you a little markup of the healthcare legislation provided to you by the American SiCKOs, the people who with me appeared as subjects of Michael Moore's documentary film SiCKO about the U.S. healthcare system. As you might imagine, those of us who were in the film were there because we had some pretty terrible things happen to us at the hands of the healthcare system. And we've been watching with great interest as this whole healthcare discussion has unfolded in the nation and want to know if the legislation and what President Obama is proposing would prevent those things from happening to us again. And we're sad to say, to a person, the answer is all of the things that happened to us would still be able to happen. So, I'm going to lay out a few of those conditions for you, tell you what we're about to do, and ask you all to join with us in demanding that we have a better system. First of all, let's look at a few of the stories very quickly. Tracy Pierce of Kansas City lost his battle with cancer. He was 37 years old, but he really lost his battle through the delays and the denials of his insurance company. His wife, Julie, and his son, Tracy Jr., told his story in SiCKO about the last months of his life when they fought an insurance company that denied right up to the end, even some of his pain-killing medication in the end. And is there anything in the legislation right now that would prevent that from happening to another Tracy Pierce in the future? The answer is no. How about little 2-year-old Michelle Keys? In the movie, her mother, Donnell, told us a story about how she raced her little infant daughter to the emergency room at a hospital in California, only to find out it was an out-of-network facility. She couldn't get her daughter treated there. They wouldn't treat her. Told her she had to transfer. The insurance company said they had to transfer her to an in-network facility. They did, but it was too late by then. Little Michelle had a cardiac arrest and died. 2 years old. Anything in the current legislation that prevents that? The answer is no. How about Reggie Cervantes, 9/11 worker? Reggie's been struggling. She can't work. She's too sick. And without a job, you can't get insurance very easily, especially when you have a condition that's causing you so many problems. Anything in the current legislation that would prevent what happened to Reggie and her ability to get insurance that would cover the situation that she has? No. Many of the 9/11 rescue workers had insurance before 9/11, and either they became too sick or too disabled to work, or they couldn't afford to purchase their insurance anymore. And it's been a horrible situation for so many of them, and nothing in the current legislation will help guarantee that those good people can get the care that they need. Many continue to fight battles for their own disability coverage and health care. How about Adrienne Campbell, young woman from Michigan who slipped across the border into Canada to get care with her little daughter, Aurora? Adrienne was a cancer patient. She had a surgery done that her insurance company would later on, in the great bait and switch that insurance companies are allowed to do, decided that the surgery she was given was routinely given to women over 26 years of age, and therefore they weren't going to pay for it. Adrienne was stung with a huge amount of medical debt that she couldn't pay. Anything in the legislation right now prevent an insurance company from making that decision? The answer is no. How about myself and my husband Larry? We always carried health insurance and a disability insurance account and a health care savings account. But because of high maximum out-of-pocket exposures, high premiums, high copays, high deductibles, when we really got sick and needed our insurance, we were laid wide open for financial ruin. Happened pretty quickly, too. And even now, I'm fighting with my insurance company to get some care that I desperately need. And you'd think I'd be able to do that relatively easily. Not true. Words like aneurysm, words like bleeding, don't mean anything to an insurance company. The words profit mean something to an insurance company. Nothing in the current legislation is going to change that. So, what are we seeing? We're seeing that insurance companies, they want it to be mandated that we all have to buy the private insurance product that's been defective for so many of us for so long. Oh, and they'll cover everybody if everybody has to buy their product. They'll even cover pre-existing conditions, they say. Okay. But that says nothing about what they're going to do once we're all captive audience, captive customers of theirs. Then they can still delay, deny, make decisions about who you see, what you get to have done once you see the doctor. They will make the decisions. They will stay in charge. And that's very, very upsetting to those of us who are in the film SiCKO. Because we know so long as they're in charge, we're not in charge. Our doctors don't get to make the choice. We don't get to make the choice. The insurance companies make the choice. So don't listen to all this stuff about there being some government official making a decision about your health care. That's just not true. We're going to send President Obama another copy of the movie, because maybe he didn't move his copy from his Senate office to the White House so he could remember the American citizens who were in that film and what happened to us, and measure his reform by what happened to us. Would the things that happened to us that were documented in that film still be allowed to unfold in the current reform environment? And if the answer is yes, go back to the drawing board until you get something that would not allow these things to happen to the American public. Because if that's not what reform is all about, then we don't understand why you're doing it. If you just want to give big bailouts to the insurance industry, you don't need to use all of us as pawns to do it, any of you. But if you really want to reform healthcare, really take the president's brave and wonderful statement as a candidate that healthcare is a basic human right, and extend it to all Americans, you're going to have to keep going back to the drawing board until you get a system that gives that right to all of us. And we believe you can do that through a Medicare improved and expanded plan. Thank you, and we'll look forward to getting all of our information to you in letter form, in video form, and asking the American people, do you want to become SiCKOs in the future? If not, then we got to fix this in the right way. Thank you.